We all have a urinary tract system, but how much do we really know about it? Better yet, how much do we know about the people who deal with them every day? Meet Dr. Naomi.
Hi, my name is Nahomy Calixte.
She's a urologist that works out of South Lake Hospital in Clermont, Florida. A urologist is defined as a doctor who specializes in the study or treatment of the function and disorders of the urinary system.
We are the surgical doctors that manages kidneys. We manage anything in the bladder. We do vasectomies. We do a lot, actually, but a lot of it is medical, but also a lot of it is surgery.
So what would inspire someone to want to become a urologist? Believe it or not, it started with a book.
I decided I wanted to go to med school when I was in Haiti. I think I was between 7 and 9 years old. I used to like to read, and I found a set of books that was about Doctors Without Borders for young kids. And then after I read it, I was like, oh, I like this. And I started reading more books about nurses too. And since then, I decided I wanted to be a doctor.
Who we are and where we come from plays a big role in who we become.
I'm very happy I have my cultural upbringing. I always say that to my family. I feel like because I lived in Haiti, I think differently. I feel like maybe I'm a little more ambitious. I know what I want. I feel like if I had lived here, I would have taught differently. Just from example of my family, my cousins and things like that. And the French education we had, I think it's also different than the education that kids get here. So because of that, I think I was lucky. It helped me even skip some classes when I came here. So I feel like I was blessed in that standpoint.
Yeah, I always feel like that because I'm also Haitian as well, and so I always feel like there's an advantage. You know, I know a lot of times in society they want to make it be like, oh, we're the victim. Like there's no advantage to being, you know, of an immigrant background or just woman of color in general.
Yeah, we have that advantage in that sense. I agree with you.
Yeah, because I feel like it gives you a reason to be challenged every day. You know, instead of approaching things with oh, it's easy for me, you have to work a little harder, but that actually benefits.
Or I also think, like you said, the victim, or because my parents went through this, I did the same is going to happen to me. So because I live in Haiti, we always knew that we were coming back to the United States to go to medical school. So I already had my goals planned. So it made it easier for me.
Haiti is a beautiful island with a population of over 11 million people. Located on the island of Hispaniola, it is known for being the first black country to get its independence. With such rich history, Haiti should be a thriving country. But unfortunately, it has seen its fair share of natural disasters, political demises, an assassinated president, gang violence, and so much more. Though mainstream media doesn't cover this often, the effects of the downfall of our beautiful motherland still affects us Haitians here in the US.
It really bothers me. And one way to make sure that I'm okay, I try not to do the news. But my mom always does the news, so she tells me. And all her friends, they do the news, they tell me. And actually, it really bothers me. It's so sad to see how far we've gone. We're worsening every day instead of improving like I think a society should be doing. Also, sometimes I feel guilt. And I'm like, how did I make it? And then someone else, which likely is the same, is really suffering there.
Yeah.
So it really affects me.
That's real. That's what we talk about all the time. It's like, we're fortunate to be here. You know, that's why I don't take America, you know,
for granted.
I'm like, you know, a lot of people don't realize. I understand there's a lot going on in America. I won't deny that. But when you think about where I could have been in Haiti, like we could be, you know,
all
not,
the time.
you know, not doctors, not doing what we love.
Even now, I still don't take anything for granted.
Yeah.
Anything can happen anytime. So
Exactly.
I'm hoping that God can continue to protect me.
Yeah.
But I don't take anything for granted.
Yeah. How does your faith like help with that at all?
I've been lucky because my grandparents, my parents were very strong in their faith, so I'm still strong in my faith too. So I think that has really helped me get to where I am.
Yeah, definitely gives you hope. You know?
Yeah, it does.
Gives you something to hold on to.
I know, you're like, what's happening? So you definitely need hope in that situation.
Yeah.
Now, with anything in life, becoming a doctor isn't so easy.
It's not easy. You have to work for it. me was really from the Caribbean, so English is not my first language. So that was definitely difficult in the beginning, because of that I had to even retake some tests. That made it a little later, so I had to go to medical school a little later because of that. Then I had to go do a master's program, which helped me get into medical school easier. So the process I felt was more difficult just because of my background.
However, having support and people in your corner cheering you on can go a long way.
Definitely my will, but my family. I have great family. I really cannot complain. They were always there. They will bring me food on the weekends. My mom, even in Haiti, will always support. She'll send money, whatever she could. And then my extended family was always there too. And then my mentors.
Yeah, that's important. Family is so key, because that's something I'm realizing, like the more support you have, you can chase your dreams a little bit more comfortably, and you actually it gives you a little bit more willpower to fight on the days that you kind of don't have.
I feel like you need to have like some type of support. It makes it a little easier for you.
Urology is broken up into various different specialties, with doctors specializing in various areas. Dr. Naomi herself specializes in...
I'm a general urologist, but I also have a little niche where we also do infertility and we do testicular pain. We actually are known internationally in our clinic. My two mentors were the ones that were the pioneers in developing like testicular pain management and surgery using the robot.
The path to becoming a doctor here in the US looks a bit like this. First, one must graduate from high school, then get a 4-year degree in college majoring in the field of science, then take every medical student's favorite test, the MCATs.
You have to pass an interesting exam called MCAT to qualify to get into medical school.
Once you pass that bad boy,
if you have a great letter of recommendation, you present yourself well, you have good grades, usually you get accepted into medical school. I do have to say that for African American or Hispanic, they have some programs where they help them get into medical school, where they really seek those type of students. There's also a way you can get into medical school as you are in undergrad.
Oh, really?
So that's another one that I usually like to tell those kids that are interested. If you have a mentor, they'll tell you early. Okay. But if you don't have a mentor, you won't know that this exists for you.
After 4 years of medical school,
you have to pick which specialty you want to go into. Some specialties are 3 years, some specialties are 6 years. It's definitely different. Mine, urology, in my program was 5 years, but I know some of them are 6 years too.
Really? Okay, wow, that's a long time.
It's a long time. I remember I've been in school since 6 years old.
Yeah. I have a lot of respect for doctors, because like I was pre-med, I was in the whole biology degree and everything, chemistry degree, and I was like, oh, I'm gonna be a doctor. And then one day I was in organic chemistry and I realized it's 8 a.m. Why am I here? Like, I do not like this.
I know it's not for everybody, right? But now you're doing what you really like.
Exactly. But I think that's what's great about following your passion and like doing what you love.
You should not do something because your parents tell you to do, and then you don't do it, and then that's when you become jaded, when you start working, or you become more burned out too, because you're not doing it with that passion that you really wanted it.
Technology is growing rapidly all around us. From self-checkouts to deepfakes, the world is evolving and technology is rapidly taking over human spaces. No industry is safe from the tech boom, including the medical field. However, for all the negatives you can say about technology, you have to acknowledge the good that it does do, especially when it comes to the advancements of human medicine and saving lives.
Oh yeah, definitely we have to move with technology. The good thing, I'm lucky in the sense that my mentors, Dr. Brownbad and Dr. Brocado, one of them went for private, and then Dr. Brownbad is still here. They were always into moving with technology. Because of that, they had the latest robot, they had the latest everything. They know the latest things that are coming out. So because of that, I was also exposed to that too. And I think we have to move with technology. We cannot practice medicine the way we were before. One, we're going to be behind, and the patients are into technology. So they want the most precise, incision that you can offer, and that's sometimes with the robot or things like that. So yes, you have to move with technology. Yeah, we cannot be paper version anymore, because most hospitals are electronic now, so you have to move with time.
Yeah. Is that a hard transition at all, considering?
It was definitely an interesting transition last year, but now that we have it, we're like, oh, how did we do without it?
Yeah.
Yes, it still has some interesting part that we want to kick it sometimes, but otherwise it's still working.
Amazing. And it's good to hear, because I know, like, you know, especially when you're doing business or anything, you have to keep up, you know, with the trends, you have to keep up, or else you will fall back. So it's nice to hear, like, doctors are thinking about that and thinking ahead.
In the medical spaces, technologies such as artificial intelligence, telemedicine, 3D printing, and virtual reality have found a home in various spaces throughout the world. Though the US is considered one of the leading innovators in the space, other countries are evolving and creating competitive technology of their own. Like China's first neurosurgery robot named Rembot, who has done various surgeries and clinical procedures thus far.
Every time we go to these conferences, we're exposed because it's internationally. Whatever other countries has something new, they expose it to us too.
Amazing. Also, there's other countries as far as their technology coming in too. Oh wow, how has that been?
It's been good. It's been good. The big meeting we go to, it's called the American Urological Association. I think it's the biggest in terms of all the urologists in the world. They come to the United States once a year. So they try all the companies, I should say technology companies or instrument or whatever, they try to come to that meeting and propose or inform us of new technologies that they are developing.
Awesome. Is there any country in particular that you're like, oh wow, they're really advanced, or?
I think they're all doing a good job, but China is definitely always trying something new.
Okay.
But Europe too, they have different guidelines they go by. So they also have some new technologies too in Europe.
So how about the US? Are we like
we're
doing
good? We're doing good.
Okay. That's good to hear.
Doing good. Yeah, we're not too bad.
Yeah, that's always nice to hear.
With technology booming in the medical spaces, the topic of healthcare continues to grow. Healthcare has become a contentious topic throughout the world, even sparking political debates. However, the medical field is not without its own issues. Doctors are dealing with a lot of pressures, while patients are starting to run out of patience.
I do think medicine is different than what it was before. Definitely different. Of course, you know, there's the physician burnout. We have a lot of EMR, which is the electronic and medical records, which kind of makes it more difficult too, because there's a lot of clicks you have to do before you get to the next step. I think we have to do a little more than we used to do before. So now, because of that, physicians are feeling that medicine has changed. The pay and the usual things in medicine.
Do you feel like doctors are under a lot more pressure now with how things are?
I think so, because there's always the decision, can I stay private? Do I have to join a hospital? I think that's the big deal now. Can the remaining physician remain private? And some of them that are hospital owned are deciding, should we continue here or should we go and become private?
Gotcha.
But hospitals are bigger, so the monopoly is easier for them.
Is it? So you are in a part of the hospital, so would
I'm
you ever
hospital
want to be private, or is that something that?
Not now. I don't think I have that in my plan yet.
Yeah.
We'll see.
As more and more doctors are needed throughout the medical field, urology in 5 years has seen a 50% increase of women practicing urology. Women urologists surpassed 10% of the urology workforce in 2020.
In urology, so far we're doing pretty great. So more than half nowadays in the residency programs are female.
Oh, wow.
So we're definitely getting better, because remember, urology was a male, I would say was more male dominant in the past, but nowadays we're doing much better.
And for women who want to get in the field, Dr. Naomi's advice is find a good mentor.
I feel like in life you always need someone to push you further, and because the majority of the time they already went through it, it makes it, they already know the pathway, so they also tell you what to expect, so I think that makes it easy. Having a good mentor is good because you have someone you can talk to. If you have a difficult case, you can just go to that person, and having a good relationship makes it even easier because that's your backup. You don't have to feel scared to discuss that with that person. So I definitely feel lucky here. My mentors that train me are now some of my partners, so it makes it easier too. He's
We've been
my
together
boss.
for what? No,
he
I'm not.
trained me in what I'm doing.
Not your boss.
Don't listen to him.
You'd be the boss on paper,
He actually,
but she's the boss in real
yeah,
life.
right.
Urologists deal with all kinds of illnesses that affect the urinary tract system. Some of the common issues that plague people are kidney stones, UTIs, bladder control, and prostate problems. So what are some things you can do to better your health in this area, especially if you are prone to kidney stones?
We're pretty big about education for prevention. So I usually tell my patients, make sure you drink at least 2 liters of water. Really, it's 2.5, but it's so much that I tell them 2 liters. Okay. They need to put some citrus. They can do lime or lemon, that helps decrease the risk of stones. And then there's a long list of other diet that we go over and we tell them to do. If they are recurrent stone formers, then we do more of a metabolic workup to see why that's happening. But sometimes it could be genetic, or sometimes there could be some very abnormal metabolic disorder that caused them to have stones. But majority of the time, it's because of our diet and dehydration.
Okay, it's good to know.
Yeah,
You need to drink
you know
water.
the people that like sodas and stuff like that?
Yeah.
Prostate cancer is one of the leading cancers of men. As women, we can help the men in our lives stay vigilant and aware of their prostate health by doing these things.
They listen how their husbands or boyfriend are doing. They can hear if there's an issue the way they urinate. If they're in the toilet and you hear drops, maybe they're having difficulty urinating. So that will be something like you can discuss it and say maybe you need to be evaluated. Or if they're complaining, that's another sign something is going on. And then also making sure that you also remind them to go for their follow-ups. Okay, those are ways to help prevent. And then I guess encourage healthy eating, healthy habits, and exercise together.
Yeah. It's always good. Things that couples can do together is exercise.
Yeah.
Doctors on average can work anywhere between 40 to 80-hour work weeks, which leaves most of us with the question.
I know being a doctor, you're always busy. Do you have time to have a life? Like, how does that work?
Yeah, we make time to have a life. We work hard, but we do party hard too. That's the motto of our office.
That's a good motto to have.
Yes. So yeah, we do. We definitely have at least, in my practice anyway, we have at least 2 to 3 weekends off. So we do have those, and if we schedule our clinic properly or surgery, we can still make it home by 4 o'clock or 4:30.
Oh, okay.
So everybody's different depending on your volume and what you want to do with your clinic.
Yeah, that's good to hear. Because I think that could be a little bit of the turnoff sometimes for women. It's like, oh, I want to be a doctor, but their lives, it can be a little hectic.
It is more difficult for a female, definitely, because then if you want to get pregnant, or it still makes it more difficult. It's easier in other countries like in Europe, but America hasn't caught up to it yet.
Yeah.
So what's one fun fact about Dr. Naomi?
I'm quirky. The reason I pick urology is because the other doctors are as quirky as me. So I definitely have a sense of humor. So I think that's something that I definitely appreciate.
Speaking of humor, here's a quick urology joke. What did the urologist say to their patient? You're in trouble. Da-da-da. Yeah, she's probably funnier than I am. All in all, urologists have an important job in making sure our urinary tract system stays on track. Thanks to Dr. Naomi for introducing us to her world and opening my eyes to a field of medicine I didn't know about. Wishing her all the best as she continues to forge her path in the urology world and inspiring people along the way that if you put your mind to something, you can achieve your highest goals. And remember, drink that water so you keep those kidney stones away. This is the road to 1,000 with 997 more to go. Next up, we travel back down to Tampa to meet with Christina, an interior designer, mother of 4, and lover of dance, as she takes us on a tour of several of her projects and shares with us what interior design is all about. Be sure to hit that like button because it definitely helps us tremendously. Thanks for watching. Be sure to subscribe to this channel so you don't miss an episode, and for more explorations, discoveries, and truths. Thanks again for watching. My name is Ruth, and I'm out.
And this one, actually, it's all the 4 female urologists in Florida.
Wow,
In Orlando, I should say. Jackie Hamilton is African American too.
Okay. Do you
Yeah.
know all of them? Or?
Yes, we meet almost every few months.
Oh, that's good.
Yeah.
So is it you guys are the only four, or?
Wow.